Hello, everyone. Before we start, take a quick second to think about how many people we know in our own circles that currently vape. Quite a few, right? This specific behavior was picked up somewhere between adolescence and young adulthood, and we aim to address it at the source. We are Group 7, and our project focuses on increasing vape risk perceptions among adolescents and young adults. Let's start at the national level. According to the CDC, 1.6 million US teens reported vaping in 2024, which is a stark increase from recent years. So, why is this important? Here at home, 1 in 10 LA County high school students currently use vaping devices, and 30% have tried vaping at least once. This translates to adult use. According to LA County Community Health Profiles, 5.7% of adults currently use e cigarettes, with higher prevalence in Metro LA at 6.8% compared to the San Gabriel Valley at 4.7%. The numbers in the previous slide may seem small, but as previously mentioned, we all know at least one person who actively vapes. Relativity breeds a sense of safety or trust, which in turn can enable the initiation of this behavior. Some people start vaping due to this very reason, and some as a way to quit cigarettes. Vaping is everywhere at bars, college campuses, outside hospitals, family gatherings, the list goes on. In fact, the vape industry relies on this widespread usage. Our friends, family, and colleagues are their free walking advertisements. When vaping is everywhere, it feels harmless, but as we all know, it is not. Evidence and literature also support this. In a recent 2025 study by Cho et al., it reaffirmed that early vaping in high school and frequent use is associated with an increased risk of nicotine dependence in young adulthood. Furthermore, it identified a unique population, late use initiators, or those who pick up vaping after high school. This population is interestingly at risk of rapidly progressing to frequent use and vape or nicotine dependence within as little as 1.2 years. Here are the graphs from this study which illustrate this data. In the top left, it shows early exposure, which equates to steady escalation of usage. In the top right, it shows late exposure, which doesn't eliminate the risk, just delays the trajectory of usage. And in the bottom left, we have our late starters, those who start after high school. It shows a rapid escalation of usage and high dependence. This highlights the significant opportunity to target this population for interventions that specifically increases risk perception, with hopes that increased awareness would translate to future vape abstinence or cessation.
So for asset mapping and HP 2030 objectives, we chose three objectives and looked up the status on these objectives as of today. The first objective being reduce current e-cigarette use in adolescents, and the status on this one is little or no detectable change. And the second objective is reduce current use of flavored tobacco products in adolescents who use tobacco. And the status on this one is baseline only, meaning that it's still new and there's still a lot more work to be done, and it's still early in research. And the last objective is reduce current tobacco use in adolescents, and the status on this one is getting worse. So we decided to directly tackle these objectives with our tabling intervention and speak to adolescents and young adults about the health effects associated with vaping. And for asset mapping, we thought the biggest asset we have in our community are the people, so we decided to interview a vape shop worker, vape distributor, and several vape users in our field research. And from those encounters, we found that there's a lack of targeted cessation for those who do vape, and we also found that there's a high appeal to different flavors. And for our last finding, we saw that vapes are easily accessible and easy to use due to its undetectable smell, unlike smoking a cigarette. So, overall, we saw that there was a huge need for clear, relatable education on health risks associated with flavored air, and also a need for counter marketing against the flavoring and lifestyle appeal that is associated with vaping, which leads us to our intervention idea. And so for our intervention idea, we utilized digital outreach with evidence from a review published in 2024 that included 7 studies evaluating prevention and cessation interventions. It was found that successful interventions included features such as social media and online content, so we wanted to incorporate this into our peer-to-peer table intervention. And for peer-to-peer tabling, we found an analysis of 343 survey responses in 8 Los Angeles high schools, concluding that peer-to-peer education at schools are effective in disseminating health education in grades 9 through 12.
Now moving on to the creation of our intervention materials, we designed our project to be both accessible and easy to understand for our target audience. To do this, we used a mix of social media posts, infographics, quick visuals, posters, and peer engagement tools. These formats helped us communicate our message in a way that is short, visual, and relatable. Our approach focused on using inclusive, age-appropriate, and interactive language, while also emphasizing digital outreach to better connect with youth and encourage peer-led education. The key messages in our materials are as follows: to highlight the risks and harms of vaping, to expose industry marketing tactics, and to provide strategies for quitting and choosing healthier alternatives. Additionally, we aim to improve health literacy by presenting information in a simple, relatable way, including topics like addiction, withdrawal, and social influences. Our project supports skill building by helping our audience develop coping and cessation strategies, make informed decisions, and apply what they've learned from us to prevent vaping and further support their peers.
In terms of cultural humility, vaping behaviors are influenced by social and cultural factors, leading to differences in how adolescents perceive and experience vaping. We address this by using a conversational approach with flexible, relatable messaging and open dialogue. From a trauma-informed perspective, vaping may serve as a coping mechanism for stress or mental health challenges, with stigma and readiness to change varying across individuals. Our approach emphasized a safe and respectful space, avoiding fear-based messaging and allowing for voluntary, anonymous participation. To support equity and inclusion, all resources and participation were designed to be free and accessible. Materials were designed for quick understanding without prior knowledge, cost, or significant time commitment. As part of our advocacy efforts, we emphasize clear and approachable messaging to provide education across the diverse backgrounds of our target audience. We also partnered closely with USC Pre-PA Pathways to promote community engagement and ensured that we created a welcoming, judgment-free space that not only normalizes vaping discussion, but also encourages the general well-being of the participants.
Our intervention was an interactive peer-to-peer tabling session on vaping. Participants first completed a pre-survey in Pathways classrooms via QR code, then engaged with us at the table, where we guided them to our educational flyer and linktree resources. Afterward, they completed a post-survey to assess changes. Our objective was to increase knowledge, risk perception, awareness of cessation resources, and confidence and intent to avoid vaping, targeting at least 75% improvement. Here are the materials we used. On the left is our link tree, and on the right is our educational flyer. In our pre-survey, we had 42 matched participants, and this survey served as our baseline to assess risk perception, intent, confidence, and knowledge. Looking at our participant profile, most participants were under 18 and reported that they had never vaped or were not currently vaping. This suggests that our audience was primarily in the prevention stage. At baseline, participants already had high risk perception and intent to avoid vaping. For example, 66.7% rated vaping as highly risky, and 85.7% reported strong intent to avoid it. However, confidence in explaining risk was lower, with only 42.9% rating it highly. This suggests a gap between understanding the risks and being able to communicate them. In the open-ended responses, most participants, about 79%, identified lung-related harm. However, knowledge was limited beyond that. Importantly, about 55% could not name a clear cessation resource, highlighting a major gap in awareness. Overall, participants understood that vaping is harmful and had strong intent to avoid it. However, key gaps remained in confidence, depth of knowledge, and awareness of cessation resources. These findings highlighted the need for our intervention.
I'll be covering the post-survey results. We received 128 responses in total, but 42 participants had matched pre- and post-surveys, which were included in our final analysis. Our participants ranged from under 18 to 29 years old. The majority of participants were under 18, totaling at 28, while the other two groups each had 7 participants. As expected, responses to the 3 repeated Likert scale questions shifted away from the 1 to 4 range toward 5, which is reflected in these 3 graphs, indicating increased knowledge, higher risk perception, and greater intent to quit or avoid vaping. We also repeated 2 open-ended questions. An unexpected finding was that post-survey responses became more detailed and concrete, with participants referencing specific impacts such as reduced attention span and developmental concerns, and even citing hotlines and websites, indicating a notable increase in awareness following the intervention. Moving into the discussion and analysis, participants showed increased perceived risk, stronger intent to quit or avoid vaping, and greater confidence in explaining these risks to others. This suggests our interactive approach was effective in improving awareness and understanding among adolescents and young adults. Overall, we were able to successfully achieve all of our project objectives.
All right, and for our conclusion, we have star, star, wish. Our first star is tabling engagement. We're very proud of the engagement we had at tabling. We had a lot of youth come up, excited to learn about vaping, see our visuals, get some prizes, and also excited to share about their own experiences with vaping or being surrounded by vapes. We also had a lot of engagement with our pre and post surveys, so this overall was very successful. For our second star, we have strong team coordination. So we had clear roles assigned at the table. We had greeters, educators, survey leads, and overall, this kept the flow efficient, especially with such a large group. We were able to usher in and keep everything coordinated. Uh, Also, we had effective communication amongst each other and also with the groups, explaining our projects and our surveys to them, and just explaining what's going on overall and what our tabling is about. Overall, everything led to a smooth day from setup to teardown, sharing responsibilities and visuals and data collection. Overall, we had a successful day. We had successful outreach, meaningful engagement, and a meaningful topic for our project overall, very relevant to this day as well. The only thing we wish we could have done differently is just done more. We only tabled at one USC Pathways event, and this limited our pre and post match sample size. And this also lessens our impact as well. If we had just done this same event, but at more Pathways events, then we would have expanded our impact and expanded our data size. And now, to close all this out, we have our call to action. Scale it up, gather more data, raise awareness, and sustain impact. You have the blueprint on how we did this. You saw that it was meaningful and engaging. You saw how we set up our data collection, and you have our visuals and our QR codes. Please use them, spread the word, and let's see what kind of impact we can make on the youth in their risk perceptions of vaping.